Welcome to the College Connection podcast, a podcast presented by the College of Registered Nurses of Newfoundland and Labrador. This is the College Connection podcast.
Welcome to the College Connection podcast. The College Connection podcast is made available to RNs and NPs as a resource to promote good practice and to highlight the importance of regulation in healthcare. My name is Kelly Kane, and I'm a registered nurse and a nursing consultant with Policy and Practice at the College of Registered Nurses.
And I'm Michelle Carpenter. I'm an RN, and I'm also a nursing consultant for Policy and Practice at the college.
We have a great show for you today as we discuss the evolution of virtual nursing practice. Our guests today are Charlene Brophy and Valda. Welcome, ladies. Please introduce yourself to the audience.
Valda, you want to go ahead?
Sure. My name is Valda. I am a nurse practitioner. I graduated from School of Nursing almost 25 years ago now, and as a nurse practitioner, 19 years. I have practiced in various settings from oncology, hematology, emergency medicine. I taught in the BN, PN, and master's program for 13 years, and most recently with Fonemed for the past 5 years, delivering virtual care.
Thanks, Valda. My name is Charlene Brophy, and I'm the CEO of Fonemed. I've been a registered nurse for almost 40 years now, as hard as that is to believe. I graduated in 1987 from St. Clair's School of Nursing back then, and practiced for many years as a bedside nurse in med-surg units, urology units, and for almost 10 years in a burn unit at the Health Science Center locally.
Valda, what title do you hold at Fonemed?
So I'm now the VP of the nurse practitioner program with Fonemed, overseeing a team of 71 nurse practitioners.
Okay, great. Thank you. So our topic today is the evolution of virtual nursing practice. And we obviously can't have a discussion about virtual nursing practice without acknowledging the evolution of the nursing practice as a whole. You've both been practicing for a while. What do you think of the trajectory of nursing practice over the past 10 to 20 years? Charlene, do you want to go first?
Yeah, I think, overall what's been most powerful is the evolution of nursing that has happened over, especially the last 20 years, from evolving from being a traditional bedside nurse role to now being an innovator and a driver of change in the healthcare system itself. So nurses, I think certainly when I studied nursing, I would never have thought of myself as an innovator in any way, shape, or form. But what has happened naturally as the healthcare needs have evolved in general is that we've all become innovators. And we've changed our mindset and our thinking from, where we started years ago about solving a problem at a bedside for a patient who was ill, to how do we provide care to a patient who's ill, who's not in front of us, who's in a rural setting or in an area that still requires care and advice, but not in traditional, care, hands-on method. And it's just been the most transformational thing to witness ever, how the system is changing, and we're a big driver of that change as nurses, all of us.
And what do you think about nurses expanding out from the bedside into other domains of practice? Because we hear about nurses are influencing technology, policy development. So what's your thoughts on that?
Yeah, because, we're now problem solvers. We're being looked upon to be the creator of solutions to solve problems for individuals who are in settings that no longer have access to modern day hands-on care. So what I love about it is, as we're all being challenged to think differently in how we provide care, is we're becoming creative in identifying and narrowing our focus from what the need is for hands-on care to how can we provide care or advice or direction for care, whether that's through diagnostic intervention or whatever the case may be, remotely. And it's transformational to the system.
Absolutely.
And it's going to continue to evolve. Where we are today compared to where we will be 20 years from now, I don't even think most of us can dream what healthcare is going to look like in 20 years' time.
Absolutely.
So it's phenomenal to be involved at this point, and I'm so excited to think about what the future could possibly hold.
And what's your thoughts, Valda?
When I think of evolution of the nurse practitioner role in particular, I think back to when I first graduated in 2006. And I remember being so proud to be a nurse practitioner. I had the scope of practice printed off and the meds that I could provide and the diagnostic tests that we could do. And I had it all printed off in a binder, and it fit on one page. And now fast forward to 19 years later, I look at the scope of practice now and how it looks drastically different, with very little in terms of what restricts us in our practice, as long as, of course, we have the knowledge, skills, and abilities to handle the outcome. And, you know, the important part being is that the expansion of the role has allowed us to become pivotal as healthcare providers in terms of providing access to care to so many people across Newfoundland and Labrador as a result of that expansion.
Absolutely. Well, great. And what's your thoughts on like how the practice setting has changed to, working with, nursing, but now into working with other healthcare professionals in collaboration? What's your thoughts on that?
Absolutely. Collaboration is a key component, and it's something that happens with every other encounter every single day. Even though, the nurse practitioners are virtual and remote and maybe practicing from the comfort of their own home, it's very much a collaborative approach, from the virtual care coordinators to the healthcare navigators or virtual care navigators to the registered nurses, and we collaborate with each other. Sometimes we're working with 20 nurse practitioners simultaneously, all online at the same time. And then, of course, we escalate to other resources as necessary, collaborating with the mental health crisis team, the mobile crisis response unit. We consult with other healthcare professionals, allied healthcare professionals, and specialists as necessary. So, that collaborative approach is so important, with the patient at the center, and then we provide wraparound services as required.
Okay, great. Thanks.
So in your introduction, you both mentioned that you're with Fonemed. So can you tell us a little bit about what Fonemed is and the role it plays with virtual nursing practice?
Sure. You want me to jump in and start? So we've been in business now here at Fonemed for almost 27 years. And what a lot of people don't know is that we started here 27 years ago in Newfoundland, but with only U.S. clients at that point in time, because the CMS, the Center for Medicare and Medicaid in the U.S., had released a billing code that allowed practitioners to bill to provide after-hours services with a registered nurse. So that was the precursor of how we started here in Newfoundland. And we had one client in Southern Oregon who was a rural hospital who couldn't find anybody to work after hours. So they closed the hospital at 5 p.m. and sent us the phone calls. That's really how it started. And we grew from those humble beginnings, managing one client and about 12 calls a month, to where we are today, providing services to about 400 individual clients with services to 50 million people throughout the U.S. and Canada. And under the umbrella of virtual care, we manage upwards of 100,000 remote patient visits every single month with all of the leadership team and the senior team right here in Newfoundland. So running an operation predominantly service-wise in the U.S. and Canada, but we also developed our own proprietary technology to run our clinical programs. And we've installed that at health contact centers all over the world, in Bangladesh, in Greece, in Manila, in the Philippines, in Haiti, and in Venezuela, and Peru, and most recently in Singapore in recent years. So what we're doing is allowing countries all over the globe to provide healthcare services to their population, no matter how rural it could be. And we've had a great evolution from registered nurses answering the phone, just providing very basic advice, to bringing together a very diverse team of allied health professionals and professionals that allow us to continue to scale and grow, such as the nurse practitioners, which Valda has been just so phenomenal in bringing together a group that truly believes in making a difference in how care is provided. And it's just been, even for me at the company, the helm since the beginning, it's just been so humbling to bring people together, such as Valda and the other leaders in the company, and just to watch them, just succeed in ways that I couldn't have even imagined all those years ago. So it's been phenomenal.
That is really incredible. So evolutionary and really groundbreaking.
Yeah.
Absolutely. Yeah.
So can you tell me a little bit more, Charlene, about how virtual nursing practice has expanded within your company? You said it was telephone calls.
Yeah.
So how's that expanded?
Oh, yeah, in such a big way, it's accelerated. And again, back 27 years ago, I couldn't have even imagined another way of providing care if it wasn't over the telephone. And, over the telephone, we did a very basic triage. If the patient deemed to be, quite ill or required hands-on care, we simply referred to emergency rooms or community health clinics or page doctors or whatever the case may be. But it's evolved now to the point where there's an omni-channel approach to receiving care. So by that, I mean people can still call, and people will still continue to call, certainly until the end of my days for sure. But they can also choose other modalities, communication modalities. So they can decide to self-queue themselves for a call with a registered nurse. They can chat online with the nurse and choose to be triaged or receive health advice that way. That's a very popular channel with those experiencing mental health issues, by the way, as well, because it allows them to remain anonymous. We can have virtual calls, which is so beneficial, especially for Valda and her team as they're assessing patients and diagnosing and treating remotely and so on. And then, we've got remote biometric devices, patients all over the place on oxygen saturation devices or blood pressure cuffs or heart failure patients on weigh scales and so on, that we're monitoring their progress and their chronic diseases, remotely. And it's changing healthcare to the point that it needed to be changed, because right now we're experiencing, we've all got an aging population, not only in Newfoundland and not only in Canada, but it's the same problem globally everywhere we go. And everybody's trying to figure out how to make the best use of resources. So the more people we can monitor and care for where they should be cared for when possible at home, the better. So it's just been the most phenomenal story to move through. And now we're changing again, thinking, how do we bring more care with more devices and a greater ability to assess patients right into their communities? So we're still evolving. Every single day it's a what's next approach. And we're able to do that because we got a team right here in Newfoundland and Labrador that enable us to continue to dream bigger.
And Valda, how's the nurse practitioner role evolved within Fonemed?
Absolutely. So in the height of COVID, when the nurse practitioner program first started with Fonemed, I was a part of a very small team of nurse practitioners, one of the first few hired. And we did calls. It was primarily majority telephone based. And now to look 5 years later, we are a team of 71 and still growing. We do telephone as well as video-based appointments. We have a program that sees hundreds of booked appointments a day, and that's more primary healthcare focused appointments. And then we have programs such as our chemoprophylaxis program. So that is a program that was developed in collaboration with key stakeholders and the department for patients that have been identified as being exposed to infectious diseases. And so they needed a way in terms of to get them treatment quickly.
Yes.
To prevent negative outcomes. And so that program allows them to be seen by a nurse practitioner within a couple of hours and receive prophylactic antibiotic treatment. So that's the chemo program. And then we have the managed care mental health program. So patients that are without a primary care provider, unattached, we roster them to this program and we assess and treat them and follow them in this program for treatment of their mental health conditions. And then we are part of 6 emergency rooms across Newfoundland and Labrador. So we see the lower acuity level CTAS 4s and 5s, which are types of conditions such as med refills, urinary tract infections, sore throats, etc. And so we help staff and provide services for those emergency rooms. And then we're part of an urgent care center in St. Albans in a remote community on the South Coast, whereby it's same-day walk-in treatment for urgent care type conditions. So those are just a few programs that we run within the nurse practitioner program.
Absolutely. And I see that evolution. I know when you first started out, you and I would have conversations about the scope of practice of a nurse practitioner. So it's certainly evolved in the 4 or 5 years with having the nurse practitioner. So it's really great to see. So there's no denying that the world seemed to shift in many ways with the advent of the pandemic. And I know we all shudder when we hear about the pandemic and how things have changed. Many have suggested that COVID changed the game for healthcare delivery in our province and in the country. Would you agree with this statement?
Well, if somebody had to ask me that this adoption could possibly happen overnight before the pandemic, I would have said impossible. But what happened, within 3, 4, 5 days at the height of the pandemic, when the whole world went virtual, I can't say it was a dream come true, because at moments in time I think we all thought, how the heck are we doing this? I remember in 1 week alone during the pandemic, we onboarded 100 registered nurses in a week. Just imagine onboarding,
Wow.
training, and having 100 registered nurses prepared, and that was not even near the tip of the demand for care. And so the adoption and the acceptance and the pure desire to have it that happened immediately was just unbelievable. And what it did, it allowed consumers to become comfortable and confident in the care being provided. Whereas before, I think many people would have thought, oh, they can't do that. They can't tell me if I got whatever happening over the phone, or how would they possibly know, and so on. And, even for a lot of nurses to come to work for us today, it's a very different skill set to assess with your ears versus your eyes. And that's not something that happens overnight. It's something that really has to be learned. And it's a skill set I think many of us as registered nurses are not used to tuning into. But it had to happen because the demand was so great. And the demand was so great, it forced adoption. And what we were seeing is that, I don't know if you remember any of the media reports during the time and so on, there was nobody on their media shows complaining about, what advice they were given or treatment or so on. Everybody was saying, thank God for this, or how come we didn't know about this, or did you know that this was around long before the pandemic, and so on. So the confidence level that we had struggled previously to build, all of a sudden overnight, our reputation, that we had worked so many years to build up, it stood for itself. And, the adoption that happened, not only for us as a company at Fonemed, but for the industry in general, it's just been game changing. It really has.
And Valda, what do you think are the lessons learned from the pandemic?
Absolutely. So many lessons learned. So, change was beginning to occur prior to the COVID pandemic because we were struggling with access to care at that time as well. However, it was the impetus for major transformation in healthcare delivery because we had to. Clinics were being shut down. Patients were even told not to go into the emergency rooms unless they absolutely had to. And even then, they were too scared to go in. And so while we had so many negative health outcomes, there were some positive key takeaways as well. So it really forced us to be creative and reimagine how we traditionally delivered healthcare. And some of those solutions involved virtual care. It was a way for us to get care to those in this time where we had no other opportunity or way to do it. And now, post-pandemic, we see virtual is still here because it has proven to be a valuable part in how we can get access to care despite where you live.
Absolutely. And, as practitioners were engaging in virtual nursing practice, there was a call to the college to put out the practice expectations. So we very quickly had to pivot and to create a support document that outlined the practice expectations for registered nurses and nurse practitioners, engaging in virtual nursing practice. And so that was, approved very quickly, during the pandemic at the beginning. And it was, really, important that the college was also there to provide, those regulatory requirements engaging in this new or emerging practice setting. So thank you very much for that. It's great.
And I hear you guys talk a lot about access to care and the timeliness of care received, but I also hear with respect to Fonemed, caring for clients in their communities, in their home. And it really makes it sound like they're true partners in their plan of care. And Fonemed is assisting them with managing their chronic illnesses. So I think that's very interesting as well. And clients must be very receptive to that, being a partner in managing their health conditions.
Yeah, they are. And again, in this time, we're still evolving and listening to the needs in the community. And it's so interesting because I just think back with, my mother when I was, running this business, and she was saying, like, honey, what are you doing? What do you guys really do? And I remember, she had a urinary tract infection. She was in her 80s then and frail. And, she said, I'll have to go and get my urine test. I said, Mom, you don't have to go. We can look after this for you. We'll get a specimen, we'll get a culture, we'll get the nurse practitioner to call you. And she was ill. And she agreed to it, I think, in all honesty, at the beginning, because she was ill. But afterwards, there was no going back. And I think for 9 years until she passed away, Mom never wanted to go to a hospital or to leave her house, because in her mind, if Valda could look after her where she was sitting, then Valda looked after her where she was sitting. So it's that developing connection and a trust with your caregiver. So it's the same values and of empathy and compassion and relationship building that we all learned back in the early days of our careers that still holds true today, where you build that relationship and a sense of trust with your caregivers. That now what's happening is we have so many repeat users that they know their caregivers. Yes. And, it's funny, they even call now and ask for them by name sometimes. So it just goes to show the adoption happened, and it happened because good people who are caring for them really care what they do and about the patient they're caring for. So,
absolutely,
it's been phenomenal.
And whether care is being delivered in person or virtual, that same standard, right, would be there.
Absolutely, it's there no matter what. Yeah.
Excellent. And of course, virtual healthcare has existed for many years, but recently it is being embraced by the public and by healthcare providers as well. How does virtual healthcare fill the gaps that continue to exist today in Newfoundland and Labrador?
Do you want to start there, Valda?
You can go ahead.
Okay, so, it has existed for quite some time. And what's really driving people to accept it more than ever before, and the general adoption of virtual care overall, is pure need. And we all hear every single day stories of overcrowded emergency departments where people are waiting such a long period of time for care and so on. And, we're hearing we're all getting older. We're hearing we're all getting more comorbidities and so on. And that's true. But what we're also hearing is that anybody that's open to having a new pathway for receiving care is embracing it in a really big way. So, for rural Newfoundland in particular, again, just, we all talked about years ago how we were going to get the message out, to communities like Trepassey or to St. Albans or, up the Northern Peninsula. How would we get the message out and build a relationship? But it happened because of the pandemic overnight, because people had no other choice to access care. But even though it's been around for so long, it's still changing. And every time we introduce something new, patients are so welcoming of it now. Whereas before, change management was such a big part of everything we did because we all became comfortable in the way we access care and so on. But, because of the pandemic and the accelerated adoption, people now are going, well, what else? Like, what else? Is there another way that I can do it? Or is there another service? Or what else do you guys offer, and so on. So it's challenged us in a whole new way that, people are pushing us to be bigger and better sooner as well. And as a company, it's been great. I don't know, Valda, you and your team, witnessed firsthand the difference that you're making in the lives of people who couldn't get their prescriptions filled otherwise without sitting in an emergency room for hours on end and so on. So you're living the real-time stories, I think.
Right. And I think back to, the exciting part of working with Fonemed is how responsive we really are to the needs in the community. So, for example, when all of the fires happen in Labrador, right? And there were so many people estranged from their homes and experiencing respiratory conditions and couldn't get access to their medications. And all within a few hours, in collaboration with the department, a program was created with Fonemed being able to deliver healthcare to these patients and getting meds into their hands, wherever they were in Labrador. So that's just one example. Another example, as I mentioned, with the chemoprophylaxis program. Can you imagine how stressful it must be for family members to be notified that they're at high risk of contracting this highly infectious disease and not able to access care because either they do not have a primary care provider or they simply can't get in within a few hours? Who can get in within a few hours, right? Whether it's Emerge or with their PCP. So Fonemed, again, helped create a program whereby within a few hours, these patients have treatment and no longer have the potential to have these negative health outcomes. So being able to be so responsive to multiple needs in the community as they arise is really a beautiful thing.
Absolutely. And I was telling Kelly a story about, virtual care from my community. I grew up in Grand Bank, which is 4 hours from St. John's. And, typically, everyone went to the cottage hospital there and then became the healthcare center. But, everyone was willing to wait, 5, 6, 8 hours to see a healthcare professional, whether that's a nurse practitioner or a physician. And, it's gotten a lot worse where there's, if there has been a locum or there's no locum and they have to drive to Buren for care. And a lady mentioned to my mom the other day, they were out for a walk around the community and she said, have you heard about that Fonemed 811 service? I didn't have to wait up to the hospital 8 hours to get my, my issue addressed. So, it's really good to hear that there are options in rural and remote areas where people don't have to wait a long time. And I also see like another advantage with virtual nursing practice, living in rural Newfoundland, having to drive 4 hours, 5 hours, maybe longer in a winter storm to see the specialist. And now, having access to virtual practice or virtual care, appointments are being done over, virtual care, and you're able to see a nurse practitioner or a physician for follow-up rather than having to drive over, some pretty sketchy roads sometimes and driving in adverse weather. What do you say to that?
Absolutely. I mean, really, when you think about it, not everyone has the financial means to travel long distances. Sure. Not everyone has the ability to take time off work or have care for their families in order to enable them to travel long distances. Yep. You'll lose a full day work, traveling to receive care, and that care may take all of 15 minutes. Yeah. So why not use a virtual modality, right? It just absolutely makes more sense. So again, it's just, we're reimagining how we traditionally did things because now we know of a different way, right? And that different way makes sense.
Yeah. And I think it's just getting the message out, and so that people become more comfortable with that. But again, as we've said, since COVID, that trajectory has started, and I think it'll continue. So one of the arguments that have been made is that virtual assessments are no substitute for physical assessments. What's your response to this?
Absolutely. I 100% agree. Virtual care is best utilized in conjunction with hands-on care. It is not a replacement for hands-on care. There will always be conditions that are not appropriate for virtual care. And then even with the conditions that start out with virtual care, they still have the potential to de-escalate, and then we have to respond and escalate them for hands-on care. With that being said, though, the virtual technology that we now use has evolved so greatly that we can assess, diagnose, and treat more things virtually. So we now have virtual stethoscopes. So whereas one time we relied heavily on just phone or video consultations, we now have virtual stethoscopes. We can listen to heart sounds, lung sounds, abdominal sounds, all virtually. We have virtual otoscopes. We can virtually look in ears and rule in or rule out an ear infection. We can look in throats, look at skin, lesions, rashes, etc., gout, all using these peripheral virtual devices. And it's quite impressive how sensitive they are. It's just as good as sitting across from the patient and being in person with them. So as a result, while it has its limitations, I feel that the technology has evolved and will continue to evolve to allow us to see more and more things appropriately virtually.
Oh, great. And that's really comforting because we know we say in our virtual nursing practice document that, the standard of care is the same, whether it's virtual, practice or, in-person practice. So to see that, the safeguards that you're putting in place still meets that standard of care that's expected in your regulatory requirements is great to hear. And Charlene, I had to say, you mentioned something, and this is what we say in our document as well, is the need for RNs and NPs to own those virtual assessment skills, and that it's important that those competencies that's required for virtual care really need to be learned and supported, because, as you said, listening over a telephone is different or through virtual care than if someone is in person. So,
I mean, we're still practicing autonomously in all of the decisions we make related to patient care. And whether we're doing that at a bedside with hands-on care, or whether we're doing that over a telephone call or a video camera or whatever the case may be, we're all responsible and accountable for the care to that individual who's in front of us. And it's, I think for all of us as caregivers, as registered nurses or nurse practitioners, we're all responsible for making sure that we're equipped with the tools and the knowledge we need to be equipped with in order to make that decision. I mean, that's a key responsibility and accountability for every single person who holds an RN or nurse practitioner license or whatever the case may be. Is we're still autonomous in the sense that we are responsible for that care. So the tools that nurses need to learn to provide care over, the telephone or over a video camera or remotely, it's different than what's going to be required in hands-on care, all based on, the same background and clinical knowledge and understanding and theory and so on.
Yeah.
But it's our responsibility to make sure that, that we're aware and we're equipped with the information we need. And, the virtual care piece, as Valda said, was never meant as a substitute or to replace hands-on care ever. It's through thoughtful integration of the work that we're doing with the system in general that's going to change the face of healthcare.
Yeah, great.
Absolutely. And, you mentioned honing in those assessment skills, and I guess being able to recognize when there are limitations and when perhaps a physical assessment may be warranted in those situations. Being able to recognize those things is so important as well, and making sure those processes are in place to support the nurse and the client in that.
Yeah, I mean, there's so many lessons to be learned. You listen to a child with croup and it's got a stridor over the phone. You listen to a child with croup at the Janeway Emergency Department and so on. These are all skills that, you're not standing in front of them and looking at their color. You're saying, what color is his lips? Is there any signs of any cyanosis? Have a look at his chest. Does it look like it's sinking? Like, again, it's how do you ask the questions to think, to think with your ears while you're talking with your voice and assessing that patient. And that's a skill that's learned. And if you listen to a seasoned triage nurse over the phone, you're going to go, wow, that was amazing. It's things that a bedside triage nurse doesn't realize that they're doing or applying that a telephone or a virtual nurse needs to learn to apply. And it's the most amazing when you see that transformation happen and they develop their confidence and skills. And it's just changing your mindset of your brain to rewire to think, what would I want? What would I need to know if that child were in front of me? What would I be looking at? And the things you're going to look at if they're in front of you are the questions you're going to ask over the phone. So it's a learned skill, but it's once the nurses have it, boy, do they have it in a big way.
Absolutely. And, when we get to that level where we need to escalate care, we're able to handle the outcomes because Fonemed has developed such an extensive list of resources. No matter where the patient is, no matter what pocket of Newfoundland and Labrador, we're able to tell them, well, you need to go in for in-person care and your nearest location would be X, Y, and Z. And we're able to provide them that guidance of where they can go to get that next layer of care.
Absolutely. And I guess another competency that registered nurse practitioners would have to learn is the technology itself, right? And that responsibility to gain those competencies in whatever type of technology that they're expected to use. So, and again, that's outlined in our document, but it's good to hear that that's being done, because I hear about, remote patient monitoring and some of the different tools that you're using for digital assessments. So it's great to hear. Any comments on that, or?
Yeah, I think just that it's evolved so quickly, and now every day, we're evaluating new technology, and just even when we were going through, because we're developing a portable unit, and we were going through the evaluation of digital stethoscopes, and just learning the capabilities of some of these devices that I'm going, oh my God, wow. Like, it's absolutely amazing that the accuracy in that they're listening, and even applying the AI and when it comes to diagnostic support and so on. It's just a phenomenal era to be involved in.
Excellent. So thanks so much, ladies. This is a fascinating conversation and a very timely topic. This will conclude part 1 of our discussion on the evolution of virtual nursing practice with Charlene, Brophy, and Valda Duke. Join us next week when we discuss how virtual nursing is closing the gap in the system and the impact on rural and remote areas and what the future holds. Thanks for checking out the College Connection podcast. Remember, all episodes of the podcast can be put towards your continuing competency requirements. And also remember to subscribe to our channel, and we encourage you to like, review, and leave a comment whenever you can. Thanks, everyone.
This has been a presentation of the College of Registered Nurses of Newfoundland and Labrador.